Please welcome to the stage Cheryl Preheim, Candice Saunders, Dr. David Hess, and Dr. Russell Keene.
Good morning, good morning. So happy to see all of you and be with you here together. We are very much looking forward to this conversation. We have been talking in the back for about an hour, and we feel like we could have this conversation all day long. So we're going to do our best to keep it to 45 minutes here and look forward to sharing the expertise of our fantastic panel. I will turn it over as they introduce themselves this morning. Candice, you want to start us off?
Well, good morning, and thank you for joining us this morning with our host, Health Connect South. It's always fun to be able to be part of this important gathering of all the different aspects of healthcare. I'm Candice Saunders. I'm the president and CEO of Wellstar Health System. We're a more not-for-profit health system that provides healthcare to all aspects of Georgia. And we're an integrated health system, so we have all the different types of health services. So I'm excited to be here with you today as we talk about the important partnership that we have developed with Augusta University and with MCG.
Thank you. I'm David Hess. I'm the Dean of the Medical College of Georgia. I see a lot of graduates and medical students here. If you're a graduate, just say something. Get excited.
Give us a wave.
All right. We're the 13th oldest medical school in the United States, founded in 1828, and we have 304 students a year per class, which makes us one of the largest medical schools in the country.
Good morning. I'm Russell Keene, president of Augusta University, home of the Medical College of Georgia and the Dental College of Georgia, and it's a pleasure to be with you all today.
And we were talking in the back how loyal and wonderful the alumna group is. So thank you to all of you who are still so active in healthcare in the state of Georgia. So many of you volunteering your time. I just was learning today, even teaching and as volunteer faculty. So appreciate everybody's commitment to healthcare and your interest in being with us today. Candice, I'd love to start off with you to talk about the partnership between Wellstar and Augusta University, MCG, framed not as a transaction, but really as a true collaboration. As CEO, how do you see that true collaboration and that mindset as advancing the mission to serve the community? And when we talk about community, now we're talking about across the entire state of Georgia and underserved communities in particular.
Great. As you said, we really do see this as a partnership, not just a transaction where we're working on providing the health care. But I think it's grounded in our shared mission of improving the health and well-being of those we served, whether it's students or fellow researchers or our care delivery. And so we see a different future for healthcare. And we believe that this partnership will allow us to create a healthier future for all Georgians. And I think that's a very important component here, that by working together and leveraging all of our strengths, that we will be able to see improvement in the health outcomes for our fellow Georgians, as well as to continue to ensure that we have the physicians and the healthcare workers to take care of our families, our neighbors, and our community. Part of this is that Wellstar Health System has served for generations. We have very strong roots in the community. We work hand in hand with the community to provide our care. And then as you look at the legacy and the generations that are reflected up on the stage with Augusta University and with the Medical College of Georgia and their impact throughout Georgia. But I did want to say that we did come together because the potential's unlimited. I mean, the things that we could do together, and part of it is to kind of hone it in and start to see what's the most important. So I did want to say that it really is centers around access. But it's not just access to care, because what we've learned together, and we continue to learn, is that you also have to have access to expertise in the communities throughout Georgia if you're going to really get access to care, because you have to have that expertise. So think about the partnership of Augusta University, all of the different universities that we work with, Medical College of Georgia, and then a community-based health system that cares for the whole community. The other thing is we got to expand the pipeline of healthcare workers. We all have a mission and a duty to do that. The other area that we see is on this whole care innovation, and you're seeing that in the marketplace. They're very strong in telehealth. We're strong in digital health. How do you bring those together to ensure that we're continuing to innovate? And then we have our Catalyst by Wellstar Innovation Center. It goes hand in hand with the innovation going on in the academics and in the training of physicians and healthcare workers. And so I think those are just some of the key pillars, but it all gets back to, though, at the center of it is families, both the parents and children, and you have to keep in mind, what do they need to continue to thrive in Georgia?
There are so many important pillars you touched on, stood out to me, that Georgia needs more doctors and needs more medical professionals. So, Dr. Hess, talk to us more about that. Another goal of this partnership, I know, is to grow the medical school and the graduate medical programs. How does the expansion change the trajectory for medical students and residents across the state so that we can continue to fill the needs that we see are there?
Yeah, so just some background. Georgia ranks 40th in the nation in physicians per capita. That's primary care and specialists. And the nation is short. So 40th, when the nation is short, is a really concerning number. And then there's pockets. Much of South Georgia is severely short of physicians. And one of the things that really supplies physicians, of course, is undergraduate medical education, MCG, medical school, but also GME, graduate medical education. And Georgia ranks, my guess, 40th in the nation in residents per capita. So one of the attractions with Wellstar is when I think I first met Candice in 2017, went over there, and they had started a lot of GME programs. And, of course, we have a big GME program, and they were starting them in many areas. And there's a statistic that while Georgia ranks really poorly in number of residents per capita and physicians per capita, there's good data that if you go to medical school here and you do your residency in Georgia, the chance of you staying is over 70%. And actually, we're in the top 20 in that. In the country, so that's good. So we really wanted to work for a partner that had GME slots, because we wanted our students to go to do their residency in Georgia. So the quick way of looking at medical school is we're preparing you for residency, and then residency's preparing you for practice. So I think having these combined programs together, I think you have about 270 residents. We have 620 now, so we have about 900 residents, which is just after Emory and Grady. So, Georgia lacks the number of quality residency slots that a lot of other states have. We've only really had 2 academic medical centers, the Emory, Grady, and us, and that's where you train specialists like endocrinologists, gyn-oncologists. If you look at states similar to us in North Carolina and Ohio, they have 3 or 4 academic medical centers. So we're just structurally have some problems in Georgia. So this partnership is really helpful to that. And as Candice said so well, this was never just a transaction. We really, one of the missions of the Medical College of Georgia is to improve the health of all Georgians, no matter where they live, not just Atlanta, not just Augusta, but in South Georgia. And so we really want to supply boots on the ground physicians, but then as Candice said very well, that another attraction here was to train our students in digital and telehealth. Now the good news is, all the medical students are smarter than I am, and they're about 10 times as tech savvy as I am, so they catch on to digital health really well. but you still got to train them in telemedicine. And our students start getting trained in telehealth and telemedicine the first 3 months of medical school.
Technology continues to grow and grow quickly, and I know so does the plan to allow that kind of reach through broadband expansion. There are so many different things that need to happen simultaneously to elevate healthcare to where you all see it needs to go and are working towards that mission. Dr. Keen, I know that academic and research, that platform is also such an important part of this. How does this partnership help that expansion as another key element here?
Sure. Just to add to what's already been stated, the partnership really is just beginning in so many ways, and just the forward thinking of the Chancellor and the Board of Regents, the Governor and the General Assembly, it took a huge effort to make this happen. But part of it, when we talk about rankings, it's also, you have to take that in the context of the success of this state. We've been very successful in business and attracting other people to the state of Georgia, and we have to look at things and do things differently in terms of how we're going to deliver health care across the board to the entire state. And part of that is going to be research. It's going to be research in digital health care and how we deliver medicine. And you think about, certainly there's a shortage in general practice, but as Dr. Hess mentioned, the subspecialties, are also critically, if anyone in this room has had to get an appointment with a specialist, it's going to take a while. So how can we transform how we deliver that health care? And this digital health continuum, I think, is going to be very important. So when we talk about the research platform, the General Assembly and the Governor also approved the EPIC and getting that, and how we use that data, how we can use the data from a research standpoint to pre-diagnose disease, how can we deliver health care better. Those are the things that we're working on day in and day out, and how we can leverage entities like the Georgia Cancer Center in Augusta with the clinical platform with Wellstar and the other 8 regional campuses we have throughout the state to deliver more clinical trials for Georgians and help them be healthier, so that you don't have to go out of the state if you have a disease such as cancer, that you can actually get the latest and the best in medicine in part because of this partnership.
I've really appreciated in talking with all of you about how specific you are looking at a need and how to address it, because if you think of South Georgia, rural communities, knowing that there are fewer doctors, telemedicine is going to be a key there, but it's a very different situation in Metro Atlanta. Candice, how do you balance those different things of local decisions, maybe at an Augusta level, small communities, versus that broader Wellstar system in Marietta, to make sure that each community feels the ownership and the investment in that local healthcare need?
Well, I think that's a constant, focus for us, because what you want is you want to get the best from local decision-making, involvement, and participation, but you're also trying to leverage the overall resources of the systems that you have. And that can be whether it's Wellstar Health System supporting and working hand in hand with the local Augusta community, and then you have the Augusta University, the Medical College of Georgia, and also the Wellstar Health System, the Wellstar MCG Health, right there locally. And so it really starts back to the why you came together. And I think that gets back to the culture. And if there's a commitment to approaching it from a shared ownership and a shared governance standpoint. So it's important that you're managing expectations across your decision-making bodies and governance. So and really fostering those working relationships with your boards, with the Board of Regents, the governor, and with all USG and all of the different decision-maker groups. So there is a lot of intentional relationship management. The other thing is that we had started to work together, probably 2017, and we did some shared projects together. And over time, we learned about each other. We continued to help through improving things together. And I feel that builds bonds, but also then your doctors get used to working together, your staff gets working together. So I really do think it's a constant communication and being very aware of why we did the partnership, going back to that when you know, because anytime you're coming together, you're going to want to get the sum of the parts and the strengths, but you are still going to, there's probably going to be some give and get that I call, as you're going to get the full benefits there. So I think some of the key is communication, but it all starts with that shared mission and commitment, but then working through all of the relationships, because we get our work done through the people in the field, and their voice and their insights into what the solutions are is invaluable. So I think that is what I would say is key to it, and being open to continue to learn from each other. This wasn't a takeover, this wasn't an acquisition. This was truly saying there are strengths in all these different partners, and let's get the best out of each partner to solve these problems, because there's way too much to do. And so many things that we have to accomplish. It's best to be focused on, getting improvements than to worry about who's the boss of who.
I think it's such a good takeaway, because I thought no matter what your day-to-day looks like, learning to bring people into the conversation and drawing solutions from any corner of that room is so key, whether it is a partnership that you are sharing about in particular, or what needs to happen on a day-to-day basis in any business or doctor's office that might be out there. And as we're talking about having to navigate these differences, I was thinking a little bit, Dr. Hess, about combining forces of the Medical College of Georgia, which has a department structure, of course, with Wellstar, which would be like a service line model, so cultural and operational differences for both of you. How best do you navigate that so that it is an addition and not maybe a point of great challenge?
Yeah, that's a good question. So, academic medical centers, we have the tripartite mission of clinical care and teaching and research. But one of our problems is we tend not to be very agile or flexible, just to put it mildly. And I think service lines kind of cut across departmental structures, and in many ways they're efficient, but very, very hard to change the departmental structure because it's been there since 1828. So we kind of work around it. We fortunately, and I see two of them here, so I'll call them out, Barry Mangle and Jeff Tharp are just great to work with. So everything is relationships in life and in medicine. So you work with them, and you really can solve most of the problems. I mean, there's agreement on, 95, 98% of the issues. In some areas, there may be a department here that there isn't a service line for. So that's where you kind of got to decide, who are you going to talk to there? And we kind of work it out because they kind of have a head service line director. And then operationally, every week, in fact, I'm going to miss it at noon today. They're probably going to call me at noon because I can't miss meetings. We have a joint operating committee, which is at Wellstar MCG Health. That's what we call it in Augusta. And that's 4 and 4. It's 4 on 4. It's 4 people from MCG or AU, and there's 4 people from Wellstar, including the president, Ralph Turner, who's been a great colleague. And, we agree on probably 98% of things. But that joint operating committee is key because that approves all new hires and whether they're going to go on a different platform. So we have an Augusta University platform or an MCG platform. And that's where about 90% of our physicians are. But now as we're moving into Columbia County and moving out, we've got to deliver care. And we've got to have early appointments. And so we hire some people in the Wellstar Medical Group. So there can be some issues there. Doctors now have 2 choices. Which platform? Do you want to be on the AU platform or the Wellstar Medical Group platform? And as human nature is, they always think the other platform is better until they investigate and say, well, maybe it isn't so good after all. But they have that choice. They have that choice now, and so we have some parameters of who can go on which platform. So, I think overall we iron out, the little differences we have are pretty minor. We joke around with each other, and it works out.
Yeah, I did want to just add that with our service line model, it is looking at the horizontal journey of patients and families. So that's what these are clinical chiefs that really work with us on ensuring that we're following how the patient and the family experience us. So to me, again, it's another example of how, by bringing together those service line chiefs that are very involved in the field and the clinical delivery, but see, they have very much an interest in research, what's available in the research, what's going on there, what will be available for their patients, and then also on the education front. They still want to give back. They want to be able to help develop those future physicians and clinicians. So it's still stepping back and really recognizing what each brings to our overall shared vision and goals. And if you bring it back to the patient, whether they're coming at it through the research or the educational or the clinical, we find that they come up with really good solutions that move beyond some of that, normal kind of, I see it a little differently.
Yeah, Candice, I think that's a great segue into just how important, you mentioned research, and you think about the Children's Hospital of Georgia, and the fact that just a case in point, we have phenomenal, both MCG alums, one actually hired the other to come on, but we've got second phase clinical trials for pediatric brain tumors. And we've got people from all over the state, all over the country, from some around the world, and these families, in many cases, have been sent home with their children in hospice. And they find these clinical trials that the science behind 1 more year with your child, 3 more years, 6 more years, some are in remission. And when you think about the platform that we have with Wellstar and the Medical College of Georgia and all of AU, with this research component that we are actually life-saving, life-changing in a big way when you combine the power of the platform and delivering for patients and their families with research that's happening every single day. We've got people every single day at AU trying to find ways to change and to save lives. And you combine that with the platform, and it's just something that I think in many ways we're just getting started.
When you were talking about retention, I'm thinking if somebody works on a mission like that, sees those results, how much more does someone stay there and want to continue to grow those programs? And that's where that momentum and synergy really starts to happen. And I think any of you can add this, there might be one way to look at it in terms of one being kind of metro area focused, one being statewide focused, but the mission is healthcare, the mission is patients, the mission is families. The strength then perhaps is seeing that bigger picture, not worried about just one but all. How do you harness that kind of a strength to continue the momentum, to fit the needs that you've talked about, more doctors, technology, all of the different pillars that you've been touching on?
I think continuing to have a drive towards Wellstar, it's people care. At AU, it's life-saving, life-changing education, and you combine that to where we're never satisfied. The appetite is to improve upon every interaction, whether it's with the patient or family or in the laboratory. We've got a great culture at both of these places. I think that's played a huge part in what drives the passion for what we do. It's a life mission to make the lives of Georgians and beyond humanity better through science and through healthcare delivery. And I think capitalizing on that, but also knowing that in many ways the shortage that was referenced earlier, we've got over 44% of our physicians across the country that are going to be aging out in the next decade. Same is true for dentists, maybe a little bit more in dentistry. But healthcare across the board, whether you talk about nursing, physicians, and everything that involves healthcare, the business of it, how we've got one of the only medical illustration programs in the country at the Medical College of Georgia, and you take that with animation and how we train physicians, not just the digital and clerkships before their clerkships, but how the animation can help look at a case and help provide a better outcome. I think that's what drives us day in and day out.
Yeah, one of the things that we have recognized is that we need to meet the needs today. Okay, so and be able to have the physicians and the care teams to take care of people today. But what's an exciting component of this partnership is we can also be working together on what are the degrees and the educational platforms that are going to be needed to prepare our workers for the future jobs. Because we know with the impact of technology that is changing, and one of our goals is we want to keep our people relevant based on the job demands. And we do want to get them more job ready as they're coming out of the training programs. And we feel by working together, we can not only meet those needs today, but we can already be shaping and designing those degrees or the educational experience that will then prepare our workforce for tomorrow. And I do feel that is so important as we are looking at this pace of change and the benefits of technology, but also I think sometimes the pace of it as we're able to pivot and to adapt is a little, it can be a little overwhelming at times. And so how can we, by working together, bringing our different subject matter expertise into being more proactive and future-facing on that? And that's another exciting part. We don't know what the roles are going to be for tomorrow. But if we're looking ahead and doing our best thinking, I think it's going to help us have people be more job ready.
Thinking that's a challenge, the statistic that you shared with us, it's just kind of sinking in. You said 44%, did you say, are going to age out? And 10 years, as we see, it feels long. It's not. It's incredibly fast, especially at the pace that things are moving. I know there are systems in place already to try to build that pipeline. What do you feel, Dr. Hess, I'll start with you, is the most important thing that can happen to bring more people in to healthcare, to draw people into this profession? We know there are communities that need more touch points. We know hospitals need these employees, but how do we bring people to the table to meet those needs?
Yeah, it's a very good question. I could maybe address medical students. One of the biggest problems is there's many counties in Georgia where no one has ever gone to medical school. And so you got to reach out to those counties. So we have admission initiatives to really target students from South Georgia. And we have initiatives to try to get students from Southeast and Southwest Georgia. And, ideally you should get to the elementary school, but that's hard for us to do. But we go to the universities there. We have something called the AIM program, which is developed by our Dean of Admissions, Kelly Braun, where we go to students in college and help them prepare for medical school. Because a lot of these students from rural areas don't necessarily have the preparation. They're plenty smart. They just don't have the preparation. You got to do well in your MCATs. You have to have good grades. You have to have experiences. So we mentor them. And we just started this program thanks to Dr. Keen's support of this program. We just started that. We had our first class this year. So pipeline programs are important, getting the word out. But, it's really tough to get students from rural Georgia. The first day of a class, I always go in there and I ask the students, and there's a lot of them now. And by the way, we have campuses, Savannah, Brunswick, Dalton, Rome, Albany, and soon Thomasville and Athens. And but I always ask the students where they're from, and I say, how many are from Metro Atlanta? And about 65 to 70% of the hands go up. And I say, how many are from the Eddas, Alpharetta and Marietta? And about half the hands stay up, right? So, Alfred and Marietta, that's our farm team. But when I ask how many students are from rural Georgia, it's a small number of hands. And I always ask them to stand up and tell me where they're from, and we kind of applaud them. Not that we don't want students from Alfred and Marietta. Believe me, we do. We want these students are super, super well qualified. But it's really hard to get them. And if you don't where you train is where you're going to practice, but where you're from is where you're going to practice. So we got to get more students from South Georgia. We expect them to go back. Now, one of the things we've done to address that, once they're in medical school, we have a 3-year medical school. Mercer does this, other schools do this. But they can graduate in 3 years. But the hook is, we're going to pay your tuition, but you got to do your residency in Georgia, and you got to practice in underserved Georgia. That's called the Peach State Scholars Program. So that's once they're here. But, I wish I had a better answer for how do we get them, how do we go down to the elementary schools and high schools. We have to do better on that.
Well, I was just thinking, even just the knowledge of that, to remove the barrier of financial investment is tremendous, but really letting people know that exists and to spread the word to even the specific rural communities that if you want to do this, there is a pathway to make that happen. Dr. Keene, your insight on that, is it really, one, developing the program and then just making sure that the people who need to know about it?
Yes, it is a somewhat of a complex issue. In other ways, it can be quite simple if we can keep the students that we're educating and training today, because we've got over 90% of our students, and those greater, they're Georgians. If we can keep them in Georgia through programs like the MCG 3+, and to get that out there, but also through other innovative programs where the General Assembly and the Governor have been great partners in this, but looking at new ways that we can provide residencies here. GME slots are key. They're very key, but it's very important that we hire the best, and we have pockets of excellence all around the state. Augusta can't be the best at everything, but Atlanta, Athens, Savannah, Columbus, we can have pockets to where we have GME programs that are not only highly sought after from the Georgians that we're educating, but from other states, because it's going to take keeping our own, but it's also going to be attracting other trained individuals from the surrounding states and beyond. And I think the pathway programs that Dr. Hess and others have created throughout our health sciences arena, and even just literacy programs that we're offering, I think are very important. But it's letting these communities know that you got to start early. Mm-hmm. You can never start too early, and we nurture that. And we've got programs that we can bring students at all levels to show them that you can do this. If you absolutely can do this, and showing them and encouraging them in that way. I think
this conversation shows why the partnership is so powerful, because it's both sides of a very important equation. Were you going to add something, Candice?
I just was going to say that back to what David and Russell mentioned, but for us the pipeline starts at birth, early before birth, because with our pediatricians, they are committed to set the child up the best possible. And so we know, and it's just evidence of this that's supported by my research and my educational colleagues here and our clinicians, that if you read to in utero and you read to a child, and as a grandparent, I see that importance of reading, and to parents and in school. So we know that if they're reading and getting people, grandparents, parents, and community members reading to them from the very beginning, they're going to be better prepared for kindergarten, and then that's our future workforce. So it starts with developing that literacy, and back to introducing them along the way, though, in these moments, to healthcare professions. And what we try to do is let them know that it's more than just physicians and nurses. There's so many things today with the technology, and we have so many different skills and opportunities. And if we can even get in middle school, high school, we bring them in for internships, introductions, where they spend time with these different roles. And it makes a big difference, because that way they get a real-world introduction, and then they can start making choices. So it's just another aspect of our partnership, because then what they do look for is not only that mentorship and the support and having an enthusiastic person who's doing that role, but funding.
And you see why it's full circle, because if someone has that medical touch point, prenatal care, whether it's through telehealth or a person-to-person visit, it just sets up the next step that's so needed. We have a few minutes left. I'd love to think forward. If we could think forward 5 or 10 years, I'd love to hear from each of you what success would look like for the partnership and for Georgia's healthcare landscape.
Well, what I see as I look out, and 10 years is not that long, as we, continue to plan. But as you've heard here, there's a common theme. How we believe that platforms, whether it's the educational platform, the research platform, or these clinical platforms, were going to help us with scale to be able to get this expertise out to every corner of Georgia. So more and more, if we can make it smaller, keep it, the connections technology-wise, whereas we can have a doctor in South Georgia with a patient who needs the expertise of a neurosurgeon, and they the patient said to me, I got introduced to my doctor on the TV, okay? And so they beam in the doctor, and that local physician is looking at the x-rays and talking with the neurosurgeon, and then there's a warm handoff to where the patient comes in to the center that has that advanced surgery. But then they go back to their local doctor, and those physicians come and do rounds, but they also do it now through technology and through the digital health network. That's exciting to me. And we've seen that now with stroke, where we can reduce the time and the distance using technology. So we're really looking at how these platforms can help us bring the latest research to every corner of Georgia. And as at the end of the day, to us, it's to make together, we're going to make it a healthier place to live in Georgia. And I do think we're already seeing the impacts of leveraging those platforms and that expertise to get it where people need it, so there is more care everywhere. And then, obviously, I always got to make sure we keep the human and the humanity side of that front and center as technology plays that important role.
Yeah, I couldn't agree more. My goal would have no more rural hospitals closed in Georgia. And I think the way to do that is to support the rural hospitals. You can't take everybody out of a rural hospital. You've got to stay there. You got to keep them in the rural hospitals. So how can we do that? Exactly what Candice says. Digital health, telehealth, supply specialists, have boots on the ground, but also use AI in health. So we just started a new department of AI in health, one of the first in the country. The idea for this came from Gary Clifford at Emory. Emory, thank you, Emory, for helping us here. But it enabled us to hire, because of this great data with Epic that the governor supported, to hire Jeff Talbert, who just joined us September 1st, who came from Kentucky, who's a GRA eminent scholar. Thank you, GRA. And he has great ideas about how we can merge in with our network and actually use predictive analytics to know what patient can stay in a rural hospital, what patient needs to be transferred, and how we can help the rural hospitals, and then to train our students in AI and health. I mean, they're already trained better than I am, but great opportunity. AI is a huge opportunity to help rural health care.
And just to sum up what we've been saying here, in 10 years, success would be that not only is this partnership, but the entire state, through the partners here in this room and beyond, that we become a national model for how to deliver health care and to take the rankings of our state that from arguably poor in healthcare delivery to one of the very best in the nation, and that we're all meeting right here talking about how we can work together and collaborate together. When we talk about life-saving, life-changing education and healthcare delivery, what I want everybody in this room to know is that the Medical College of Georgia and AU is yours. We're here to collaborate with anyone and everyone we can for the health and well-being of Georgians, and I think in 10 years, this partnership will have been a wild success if we can all say that we're working together and that we can actually prove to the results.
Well, our hope is the partnership and this conversation will lead to more equitable access and quality of care for all. Appreciate all of your work. Thank you for sharing all of your expertise and your insight. The time went so quickly. I know it's just the beginning of the conversation, but thank you all for being part of it. Thank you so much.
Please Take your seats.